we go again.
Welcome to another episode of Platinum Pussy. I'm joined by a really special guest today. I'm so excited to talk to her. Her name is Dr. Shreya Reddy, and she's a primary care physician and also works in women's health. But along with that, she's also an awesome woman and has so much to share about her life experience, about love, and living in LA. So let's get right to it. Shreya, welcome to Platinum Pussy.
Hi, thank you. I'm so excited to be here.
I'm so excited to have you. So we actually met because I was a patient, or still am, at Tia Health, and that's where you work. And I was so excited to see a South Asian female doctor, which there is a lot of that out there, but I just hadn't met one in LA.
Yeah.
And immediately I just wanted to connect with you outside of that space as well. So thank you so much for being here.
Yeah.
And this is going to be really fun.
Yeah, I'm really excited to get into it.
So I want to start with kind of your journey from like where you grew up to med school and then landing in LA. I know those are big questions.
Yeah,
But.
no, definitely. It's a good story. So I'm born and raised in Ohio, so from Cincinnati, and then I did all of my medical training in Ohio as well. So I went to Northeast Ohio Medical University near Cleveland, like Akron area, and then went down to Columbus to do my residency training at the Ohio State University in family medicine. So I'm board certified family medicine physician, and I did a lot of work in women's health and just always had a big passion for that. And really made it like a thing that I wanted to continue exploring. And so after I finished my residency training at Ohio State, I moved out to Southern California back in 2021. So it's been almost exactly 4 years, which is crazy to think about. And I worked at Kaiser in Orange County. I was there for a couple of years and just really got the lay of the land of being a primary care doc and working at a large organization, and learned a lot, and then decided that it was time for a bit of a career shift. I just felt like I wanted to do a lot within women's health, and I was able to do that in bits and pieces there, but it wasn't something that I was really able to continue evolving into. And when I thought about, where I was going to feel a little bit more aligned, this job opportunity came up at TIA, and then I decided to take it. So then I moved up to Los Angeles in 2024 at the beginning of the year.
So you've had the experience of working kind of at a traditional medical organization and then pivoting to TIA, which is just so groundbreaking and different, I'm surprised that something like that didn't exist earlier on with women's health.
Yeah.
What has been some of the biggest differences in working at like a women run for women healthcare facility?
Yeah, I mean, I think it's definitely, a startup, and that's how TIA in general has started. So there's been a lot of differences just in the access that patients get. And I think there's just a big focus on providing good quality care for women in general. And I think a lot of the times, even with medical training, unless you're going into like the OBGYN route, of course, like in primary care, you will get some training in women's health, but you really have to seek it and really have to make that a priority of yours to get adequate exposure and training. So I knew that and that kind of translated to when I was at my previous job, where similarly, like I would have to kind of seek it out to do more contraception or, menopause or sexual health and things like that. And I think what TIA has done is just create this medical home to bring all of that together. There's a lot of, holistic approach, primary care approach. So I think it really focuses on seeing the woman as an entire being and an entire person with all of the different factors that are at play.
That was the biggest reason that I wanted to come to TIA. It actually popped up on social media because that's how you find a lot of things these days. But I was really this whole year struggling with anxiety and like low energy, just things that I haven't experienced in my life. Like I've always been very high octane, productive, and like go mindset. And I'd gone to 4 or 5 different doctors and gone to specialists, done like all the tests you can think of, like the EKG, like just hormone health, and like it was very piecemeal. And I couldn't pinpoint anything. And all the doctors I went to happened to be men. And most of the time, I still remember some of my results, like blood work and everything. They're like, everything looks great. Everything's perfect. You're in great health. Yeah. And I'm like, but I'm not. I don't feel good. Yeah. I'm not. Just overall, my happiness and stability doesn't feel great.
Right.
So coming into TIA and booking an appointment, getting in touch with people, having questions answered, it's been very fluid and very easy. Yeah. And more than just the medical part of it, I feel like I have a support system.
Yeah.
And I don't feel like I have to prove what I'm feeling outside of just like the medical tests.
Yeah.
So there's a lot of the sisterhood is very strong. Yes. And that just immediately, like you walk in, and if you guys haven't been to a TI Health or it's not near you, you walk in and it feels like a spa. But what you said about looking at a woman as like a whole being, that's really what was missing.
Yeah. Yeah.
And like, even though some of the tests or some of the specialists I've had to see have perhaps been outside of the network, it just feels like my medical managers.
Yeah, definitely. And I mean, healthcare is really challenging in this country for so many reasons. And I think a lot of it is because so much of it is fragmented. And you go to see, that specialist for that thing, that specialist for that thing. And I think that's why I got into primary care in general, because I kind of wanted to be like the captain of the team. I knew, everyone says, family medicine is very much like, you're the jack of all trades type of thing. You're going to see a lot of different things, and it's kind of up to you to coordinate it all. And I felt like, it's such a parallel to women and our journey and our lives, because we go through so many transitions, so many phases. And it's like, who is kind of helping us manage all of that? Like you go from, seeing your pediatrician, and then maybe, a general doctor, and then like all of the women's health stuff happens. So like, who do you see for that? And I feel like what, we've been able to, hopefully kind of make more efficient is how can you come to one place, try to get everything, or at least, a lot of things within reason taken care of, and then still refer out when appropriate, when it is outside of the scope and needs to see a specialist. But kind of to have that medical home of like your touch point, I think is really nice.
I want to turn to some of the medical, myths or studies that are out there, one in particular, and get into women's like hormones and just like the basics that honestly I didn't know until something went wrong.
Yeah.
But before I do that, I have to ask this. Is medicine something you wanted to do? Like being South Asian, I feel like we're told you're a lawyer, doctor, or a failure.
Yeah.
So I'm always curious because I went to law school out of my own will. It was not enforced on me.
Yeah.
Although my mom did like hope and wish that I became a doctor, which is why I'm wearing medical scrubs today. But to clarify, I do work as a lawyer in the healthcare space.
It's perfect.
I had these scrubs and I was like, okay, I'm gonna, role play.
It's your moment. It's your moment to shine in the scrubs. Yes.
Like, Mom, I made it.
Yes.
So, I'm curious, is that something you wanted to do, or was it like your parents' dream?
Yeah. No, great question. I think it goes so many different ways for a lot of people. I will say I do feel really lucky that it was something that I wanted to do. It wasn't something that, I wasn't like born and like I'm going to be a doctor or anything, but I knew as I was just kind of figuring out which subjects in school I was, more aligned with. It was always like the biology, the anatomy. Like I just thought the human body was so fascinating. But I think, even besides the science piece of it, why I thought being a doctor would be a really good space for me to land is because of that interpersonal piece of it. Like I think all of the science is there, all of the learning and, medical knowledge you have to gain, but to be able to communicate that with someone and hold space for someone to share all of those things in their most vulnerable moments, I think was that like really human interpersonal piece that I really needed in any sort of career I was going to pursue. And I was like, okay, well, I guess the medical field seems like the right thing. Like it brings the science, it brings the art of humanities, and just like brings that together. And I was like, okay, let's give it a try. And of course, when I told my parents, they were like not upset. They were like, okay, great. I guess this is what you want to do. Perfect. So yes, I'm very happy I was not forced into it. at all. So yeah, I think that made a big difference.
I feel like when you're not doing something for yourself, eventually you burn out and then it's just a job.
It's just not sustainable. Yeah. And I mean, definitely there are so many days where it does feel like, okay, I'm going to do it. It's my job. But then like I have these moments where that passion reignites and I'm like, okay, yeah, this was where I was supposed to land. But yeah.
So I want to turn to the study that is making waves on social media. Yes. And I have like some things to help me. I have notes that I want to read off of, but Penn State put out this study that was posted on Science Advances in August. And it's ever since I've seen one post, I've been seeing posts and posts over again. And I want to read off like the one that kind of sparked everything. Yeah. And it's it's a post that says women's egg quality stays stable with age. It's men's sperm that has a biological clock. So immediately I saw that and I was like, this is fake news, right? Because my entire life, and I think for most women, this biological clock is just hanging over your head.
Oh, yes, absolutely.
Right? And especially as someone who wants to have kids, like I do, it's always been this thing of like, okay, career or children, you know, my eggs are deteriorating, freezing my eggs, which I did earlier this year. Yeah. So when I saw this, I was just like, okay, a few things. First thought was, I'm going to be off to the races trying to be a cougar because it's rooted in science.
Yes. Science is telling us.
Literally,
younger men.
The dating range went from 5 to 10 years older to 5 to 10 years younger.
Right.
And then the other thing is also part of me felt this feeling and understanding of men wanting to date younger women. This is not in support of men, but to clarify, it's just my immediate thought was, okay, I want to have kids and I want the most suitable partner. And that is a rhetoric that you hear sometimes with men is like, oh, you want to date younger because you want to have offspring. Right. So I just think it just turns the whole dynamic on its head about how we've thought about like dating, about women feeling empowered about their bodies. And there's just so much to unpack there. Yeah. But I want to read off some of the stats and claims that it makes and just a little bit about the study. And then we'll take it bit by bit because there's a lot there.
Definitely. And I'm going to grab my notes too.
Egg quality remains surprisingly stable as women age. And research shows that eggs have built-in protective mechanisms that safeguard them from age-related mutations, which I know is a big one for childbirth. And then it also finds that eggs accumulate very few mutations, unlike cells and sperm. Sperm quality, unlike eggs, sperm cells continue to divide throughout a man's life, leading to accumulation of genetic mutations with age. These mutations increase steadily with age, particularly after 40, and contribute to certain developmental and neurological conditions in children. The accumulating mutations also mean that sperm quality declines with age, which affects fertility. Okay, a little bit about the study, which I found from ChatGPT, if I'm being honest, is that, so they examined 80 eggs from 22 women aged 20 to 42. Now, just thinking about sample sizing, because I was an economist, not in the healthcare space, that seems like a very small sample.
Yes, definitely.
So we'll definitely address that and how medical studies are performed. And then it was specifically about the mitochondrial, I'm butchering this. The mitochondrial DNA mutation counts in eggs remain stable across ages. I want to kind of start with women's eggs in general, right? Because when I froze my eggs, I went to a couple of different places and I won't name which ones, but I had a very negative experience. The first center I went to, it was just there was a scarcity mindset of like, we don't know how many eggs we're going to get. It might be like 3, it might be 5. Yeah. And I think they were trying to give me numbers to just level set.
Right.
And not like have really high expectations. And then I ended up, doing the egg freezing and I had 20 eggs, which I thought was like really, really great.
Yeah, that's a great
and
number.
made me so happy. But I also believe that your egg quality drops significantly.
Yeah.
And I had this regret that I didn't do it earlier because now I'm like mid 30s and I was like, I really wish I did it at 30. So for me, one of the deeper, bigger senses of relief from seeing this study was like, okay, my frozen eggs are good.
Yeah.
Like the quality is going to be good. So I want to kind of talk about women's eggs and women's egg quality over time.
No, definitely. And I'm sorry you had that experience. I'm glad it ended up, working out really well. But I think that's like the thing in these really like intimate experiences and these really vulnerable experiences just to be handled with care. So, I hope that's just, a big call to all of us in the medical community that this is, your life and your fertility and your reproductive journey. So, but with eggs, so, I guess some like basic science right off the bat is we are all born, like women are all born with the number of eggs that we are going to have throughout our reproductive journey. So we don't make any more eggs, like we are born with what we have. And then we actually lose most of them or a lot of them when we're in utero, like when we are still developing in our, mother's pregnancy. And then when we are born, we continue to lose some, and then we get through our adolescence. And then when you start your period, that's when your body starts to release an egg every month. And then, you continue to do that until you hit menopause, which is ovarian failure. So,
and I just want to ask just for people, because I didn't have an idea of those numbers. I understood that's how it works. But what are we talking? Like you're born with 10,000 eggs and like,
that's a good question.
what's the, really definitely. Please do. Cause sometimes it's like when you're speaking broadly, like cause in my mind, I honestly didn't understand that much about fertility and all of these things until I got older and I actually thought about it. So it's confusing because especially going in for some of those tests while being on birth control and seeing that they can only see 8 follicles or 4 follicles on one side is, in my mind, that's telling me I only have 12 eggs.
Right. Yeah. And all of that can get really confusing and the numbers can be really misleading. So I definitely will go through I'll go through the numbers for sure. Okay. So using my resources here. So basically we're born with about 1 to 2 million eggs. And that is what, have developed within us before, we are born. And then through the time of our childhood, adolescence, until we hit puberty, then we drop to about 300,000 to about 500,000 eggs. So we're losing the majority of them before we even start our reproductive cycles. And they're just degenerating. There's nothing, wrong. That's just the natural progression of the eggs degenerating. Okay, so then by the time we get to puberty, we're around, 300,000 to 500,000 eggs. And then now when puberty starts, this is when our ovaries, there's a vault basically, and the vault has these immature follicles, these like these immature eggs that need to be developed. And so each month your ovary, one of them, it kind of alternates between your right and left one. It'll release maybe like a number of follicles, maybe like anywhere from 10 to 20 follicles. And then some of these follicles will continue to start the maturation process, and then one will fully mature, and that's the egg that will be released into your uterus, and then hopefully hang out there, in case it's going to be fertilized. And then if it's not fertilized by a sperm, then it'll degenerate, and then that's when your menstrual bleeding starts. So with that process each month, it says about 1,000 eggs die off each month even. So you're releasing, a handful, one of them matures and releases into the uterus, but then you're still getting a lot of this natural degeneration process that happens. So then by the time menopause hits, which is usually late 40s to mid 50s in women, you have fewer than 1,000 eggs that are left.
When you're comparing that to like starting with like millions and then by menopause you have 1,000, that sounds a little depressing. But when you really think about it, you need one.
Exactly.
Right?
Exactly.
So it's like it kind of eases my stress a little bit about the number that's available. At least through your 30s. If I'm trying to have a kid in the next few years, there's enough there. But talk to me about the quality.
Yeah, definitely. Yeah, and that's a good point. I think like hearing the numbers makes it feel a little bit less dire and less like, oh my gosh, I have one egg left. Like when when I'm going to use this one egg? But the quality is another big piece of this. So, you know, when you're doing your egg freezing process or like a fertility evaluation, like it is true that when they do the ultrasound, you see like the number of follicles that are in the ovary and kind of get an idea. But what's really hard to tell is what the quality of your eggs are doing, because that, you know, requires like an egg removal, retrieval, and then it's if the reproductive endocrinology doctor is able to do some testing on it. But what we've found through research is basically from the ages of like from your teens to your, you know, mid-20s, your egg quality seems to stay pretty stable. And then a lot of research is saying even up to like 30, it's pretty stable. But then 25-ish to 30 probably has another level of stability. Maybe it's a little less than when you're a teenager, but I would say throughout your 20s, it's looking pretty good. Then when you're 30, it starts to decline a little bit. And then usually the other benchmark or I guess grouping is like 30 to 35 is it does take a little bit of a decrease in terms of quality and number, you know, of course, when you're compared to your 20s. But then there's a little bit more of a significant drop off after 35. So from, you know, doing some research and then also speaking to some like OBGYN and REI colleagues, they have, you know, recommended that if you're able to, you know, freeze your eggs before 35, that's probably a good timeline to do it. Because then after 35 to about 40, it does take another, you know, fairly steep decline in the quality. And then after 40, we see another pretty steep decline. So it's kind of like this stepwise decline, but it is kind of common practice to try to do it like an egg freezing or think about fertility like in your, you know, 20s and especially before 35.
Tell me about when you say that the egg quality takes a decline, how does that affect the woman during pregnancy, or is that more effects about like birth defects? How does that really impact things in the long term?
Yeah, I think a lot of it is based on the viability of the egg. So it's almost like what are some of these abnormalities or mutations that are happening within the egg that will allow an embryo to develop appropriately. Like after the sperm fertilizes the egg, what's the success that the cells will continue to divide and mature and then be a viable pregnancy? So I think that's one thing. Like as we get older, there are more risks for these DNA defects or these chromosomal abnormalities that just will cause your body to like spontaneously like abort the pregnancy. But it can also lead to higher rates of birth defects, like you mentioned, that can stem from the chromosomal abnormalities. But even, you know, things like Down syndrome and things of that nature that we've seen throughout time. So those abnormalities that can persist, it's almost like your body's way of trying to not allow a pregnancy to continue if there's really going to be a tough time for the pregnancy to develop into like a normal fetus and a normal developed child.
Yeah, I think that makes a lot of sense. I want to pivot to the sperm though.
Yeah.
Because that's something that doesn't really get talked about. And I will say that I have in the past had a partner go and do a fertility
like
test.
A semen analysis?
Yeah. Yeah. And
as in like you wanted them to go do it. Yeah.
Yeah.
Totally.
And I cannot tell you how offensive that was initially. Yeah, because it's I don't know that it's something common for a man to think about.
Yeah.
Especially if they're in their 30s, right? Because you hear of men in their 60s, 70s having kids with like 25-year-old women. Yeah. So it's like the sperm is great.
Yeah.
And you know, there's so much of it and it's perfect.
Right.
So
never their fault.
Yeah, exactly. So I think with the whole breakthrough, it just brings a little bit more attention to the men's body as well. In preparing for this episode, I've been reading up on a couple of different things about the sperm fragments and that makes pregnancy harder and how like over 30 with men, they're more prone to issues like that.
Yeah. Yeah. Now, I will say I'm not a fertility doctor, so I think about, you know, the women's piece of thing. I don't think about the sperm piece of the things as much, but I will say I think it's so important for men to be a part of the discussion. I think for so long, like, we have focused on female infertility or female fertility issues. But I mean, you know, as I see a lot of couples that are starting their, you know, fertility journey, it's my first question is also like, has your partner fathered children? What is your partner's health history like, and have they done any sort of testing? Because that's 50% of the equation. And I think it's so easy to focus on, like, yeah, the egg quality and the egg numbers and all of that. But I mean, yeah, the sperm quality and the sperm numbers take a hit too. I don't know all of the numbers and the ins and outs of it, but I do know that it actually takes like really good, strong, high quality sperm to penetrate an egg. And it's not, and I think like when we see these cartoons and anatomical descriptions, we kind of think of it as, oh, it's just one sperm that's going and like meeting an egg and like fertilization happens.
Yeah.
But it's actually like hundreds and maybe thousands, I could be but it's a lot of sperm that are going to like crack the shell of this egg. And they're all kind of working as a team to like jostle this egg open so like one sperm can go in and then fertilize it.
Okay, I have to digress a little bit because this is basically, I feel like
it's like Sparta or something. Like,
literally, it's just exactly the way men and women work in dating. There's like hundreds of men trying to go after one woman, and it's like, who can be the one who can break through? So their sperm is literally doing the exact same thing. So
it is all biological.
It's all by design.
It all makes sense. The dating scene all makes sense.
That's hilarious. Okay, so you have like hundreds of sperm kind of swimming. It's survival of the fittest.
Exactly.
Who's gonna make it and breach.
But they all work together. Ish.
Okay.
To try to break open and then penetrate this egg, and then one will survive. Literally, only the fittest will survive.
I feel like this is like the breakthrough in the conversation.
This is Survivor. This is exactly.
I mean, I feel like I had an idea of some of that, but the image that's in my head really is that like little sperm just and going to the egg, and
just the one cute little sperm is making it to the cute little egg. Yeah, I know. It's wild. But I think that also goes to show, like, with the quality, it's like a quality of sperm issue as well, but it's also a motility. Like, how are the sperm swimming? Are they strong swimmers? What's the quality? Are they able to attach and adhere to the egg? Are they able to kind of navigate their way in? And I mean, there's so many factors that affect just women's overall health, but men's overall health too. And things that have come out, you know, not super recently, but like marijuana use, tobacco use, like just chronic levels of stress and inflammation, like all of these things like really affect sperm quality, motility, fragmentation. But I mean, just as much as they affect, you know, women's overall health and ability to conceive and have all these pieces work. So I think just kind of taking it back to the whole holistic piece of things, like, yeah, we can look at the numbers, we can try to get an idea for what the quality is based on age, but really like putting all those other lifestyle pieces into it and making sure that the couple and the partnership is really aligned is going to be super important. Because I actually remember I had a patient who was, you know, this couple was really interested in getting pregnant. And she was doing all of the things she could do. She cut out alcohol. She, you know, was eating a really low inflammatory diet, exercising 5 times a week, you know, sleeping super well, doing everything she could. And then her partner was not making any changes. And, you know, I don't know if it was coming from my sperm is fine, like I'm in my 30s, like I don't have to do anything. But I mean, it does make a difference. And I think like that has to be a core tenet for when people are starting this fertility journey.
Yeah, I think the point you bring up is so great, that it's two people together, and it's both of your bodies and what you're doing in your day-to-day life. And while I'm in disagreement with all the social media posts that are pretty much just saying like women are not the problem, men are the problem. I just don't like that negative, you know, positioning of something like this. But I think it is great because it's making men also think about like they don't have they're not immune to life and the things they're doing for themselves. And also I know, especially culturally in the South Asian culture, but even outside of it, anytime there is a fertility issue, the woman is always looked at as the problem. And I know a couple where they were in this situation And I think it was much later on that they even thought, well, maybe there's something going on with him.
Right.
And there actually was something going on with him.
Yeah.
So I just think getting this information out there that both people should just be vigilant and on top of it is so important.
Yes. And especially now, I mean, it's not the case all over the country, but in big cities and especially here in LA, there is access to these, clinics that can do some semen analysis and do those types of testings. And I think it's important. Like when we were, learning in school, it was if you're under 35, try for 12 months to conceive. If you don't conceive, then start talking about fertility with your doctors. And that, or if you're over 35, then try for 6 months. And then, that's kind of like the adage, like that's what we should be doing. But then since I've been working in this space a lot more consistently, I'm like, I don't know that I subscribe to that actually, because time is so important in this in this space, and especially when a lot of us are waiting until our 30s, 40s to have these, conversations. Like, sure, definitely optimize your lifestyle, track your cycles, do all of the things, give it a try, but at least have the discussion with your doctors and your healthcare team that this is something that's on your mind, just so as a team that, we can all work together on when should we loop in testing, when should we start thinking about specialists, because we just don't want to waste time when we don't have to.
Yeah, I agree. I want to pivot to, because you brought up hormones and your cycle and tracking that. And my next question was going to be, what can women do to kind of stay on top of these things? But I feel like you've addressed some of that. But if you want to touch on maybe other like lifestyle choices that you should be making and kind of staying on top of, like outside of just the regular testing and checkups, like what can you do to promote like your fertility?
Yeah. So, super important for people to understand their menstrual cycle. So of course there's the follicular phase. That is when the follicles are starting to develop, and then one egg fully matures, and then you have your LH spike, and then it, releases, and then biologically now we're seeing if a sperm is going to fertilize it. If no fertilization happens, then with the changing of hormones, then the egg is degenerating, and then you shed the lining of the uterus, and then you have your period.
And I feel like that's the only part of the cycle that most women know.
Yes.
And that's the part of the cycle that I always focused on, where it's like, okay, this week I'm on my period, I'm going to be low energy, and this is what I should eat or, take care of myself. And and it kind of stops there.
Right.
So I'm really liking that you're breaking this down.
Yeah.
Because believe me, it'll be news to some people.
Yeah. And I mean, it's, when we learned about it in school, it was so just basic and bare bones. And at least where I went to school, it was very much just like, this is what happens. Like, here's your goodie bag of pads and liners, and like, we're done talking about it. But it's so important to understand from a younger age, I think, like, what are the different parts of the cycle? Why do you feel a certain way? I'm happy to talk about it. But basically in the follicular phase, there's a lot of estrogen that's being produced from the follicles that are developing. So as the estrogen is produced, it's kind of like a feel-good hormone. Like, you're feeling high energy, you're, super focused, mental clarity, your skin looks great. Like, everything just feels like it's falling into place. And that is a really good phase for a lot of people. And then the egg gets released, and then there's, a few days where we're waiting to see if fertilization happens. And then there's, a dip in the estrogen, but then there's a further dip in estrogen when the corpus luteum, which is the home that the egg is released out of, starts producing progesterone. So now progesterone is another hormone that is really important just biologically to help promote a pregnancy. So its whole function is, okay, we need to thicken the lining of the uterus. We need to really make this environment hospitable for a potential sperm to come fertilize the egg, and then if it turns into an embryo, to make it a good home. So the progesterone is high during the luteal phase. Now the luteal phase...
And what does that do? Like, because it's... Even for me, now I understand some of these words, but like, what does it do to your mood when your progesterone's high?
Yes. So progesterone, if we think about it, like, okay, if it's trying to get your body ready for pregnancy, we're going to be tired because your body's trying to accommodate for this. It's going to almost want you to be at home, be in your sweats. You're going to feel a little bit more bloated. You're probably going to feel a little bit moody, lower energy, want really just like what is it? Just like carb heavy foods, higher sugar. Just, it's like a comfort phase. So this is in a 28-day cycle, this is like the 14 days before your period starts.
Okay, got it. Is it usually the whole 14 days, or is it heavier closer to your period?
It depends, but in a perfect 28-day cycle, the progesterone does continue to rise. So it can get worse as you get closer to your period.
Yeah.
And then what happens when the progesterone level drops and you start bleeding is your estrogen and progesterone both drop. So now you're just kind of feeling low from both ends. So you're just feeling just kind of crummy in general. But when people talk about the luteal phase, it's usually like a week before your period, but it can even be a couple weeks, and it just depends on the person, how intense
because for me it's interesting because it gets pretty strong the few days before. Yes. And then it's almost like I get more cramps during the period, but it's my mood almost is like kind of getting slightly better in some ways.
Yeah, and that's because there's that drop off in the progesterone. But then the cramps, mainly because now your uterus is contracting, just like releasing the lining, and that's where the cramps are coming from. But I mean, it's so important to know, like, why do you feel like shit these weeks? Like, why do you feel like on top of the world the other weeks? Right. It's hard to know.
I want to get to the ovulation phase though.
Yes. Our
because
favorite
am on fire. Like I track when I'm gonna ovulate because I'm invincible. I'm like doing CrossFit. I'm doing all my meetings. Like if I have to walk into boardrooms and negotiate with lawyers, I'm like, I'm ready. I'm so fired up. Yeah. So tell me what's happening in our bodies, and it's so short lived. That you've got to max out.
Yeah, definitely. So ovulation, yes. So basically, with the follicular phase, estrogen is being produced, and it's there. It's in high numbers. But then your estrogen has to get to a certain number to feed back to your brain to release LH, which is luteinizing hormone. So that is a hormone. So when your estrogen is at a high enough number, it tells your brain to release this, to send the LH signal. Then you have the LH surge. So when that happens, the egg is actually released from the corpus luteum. So that's the home that it's sitting in. And then there's a temporary like spike in the estrogen. So that like feel good hormone that's making you feel like, you're crushing life. Like you look amazing, you feel amazing. Yeah. But then you like really want to have sex.
Yes. Okay. That's the big one. It's like you are just animalistic.
Yes.
It's so wild.
And it's this like biologic component where now you're ovulating. So like you have this maybe like 3 to, like 2 to 5 day window in which a sperm can come. So now you're like, okay, like I need to find a sperm to fertilize this egg.
The thousands of Spartans fighting.
Yes, exactly. So then so many women are just like, because then your cervical mucus changes. That's another way you can know you're ovulating. You might have some spotting. So it's called middle schmerz. So it's kind of an outdated name now, but it's mid-cycle spotting when the egg is released. But really it's that feeling of like, oh my gosh, like I need this to happen.
Yeah. It's like you're on the prowl. It's so crazy. It happens to me every time. And really? I'm like, but I always I think of it as just using your sexual energy in like whatever you want to get done. Like you feel so strong and confident that you just got to go after it. Yes. It's like literally the platinum pussy energy. Like that is the time where I'm like, I have massive big dick energy right now. Like I can rule the world.
And I think and I actually love like blaming my hormones now on my mood and how I'm feeling throughout the month. Yeah. Because if I'm like irritable and I'm like, oh my God, I look like a gremlin, like what is happening to my life? Yeah. It's like I'm probably just in my luteal phase. And then typically it does align that way. So it's like, it's such a cycle. And so I think it's also so important, like when your emotions are, just down and you're not feeling your best, knowing that this is probably hormonal, and then there will be a time in which you get back to that follicular phase, get back to ovulation, and have that energy again. Like it's so cyclical.
Well, I think men really need to understand this. Yeah. Because and it's interesting. I feel all my phases of my cycle a lot more after freezing my eggs.
Interesting.
And it's a big shift I noticed. And I don't know if it's just because of society and culture that I'm a lot more comfortable in my body and being a woman and being different and having varying emotions, that I feel comfortable expressing that because I think in my 20s, especially being in New York, being in corporate law, I just felt like I had to power through.
Right.
And there were so many times where I had colleagues. I remember one of my colleagues, he asked me once, this is funny.
Oh gosh.
He asked me once, he's like, I have a weird question. I was like, what is it? He's like, when did you get your period? Which immediately I'm like, dude, I'm calling HR.
Right.
But we were friends and I knew his girlfriend and I was like, okay, maybe he's asking for his girlfriend or like, I was like, I'll leave the door open. But he asked me that question. He's like, I have not seen you be moody or have mood swings. And we've been working together 3 months.
Wow.
So I was like, I do get my period. And at that time I thought it was so, big dick energy for me to be like, oh, I'm not like other girls. Like, it's not a big deal. Like women make so many excuses. Like I'm fine. I can power through.
Yeah.
So I think I just suppressed that emotion or that feeling, or I was like, I have to, because I have to run with the boys.
Oh,
right?
Totally. And in that field for sure.
Yeah. And now I'm just so much more comfortable and confident with what I do.
Yeah.
I've literally walked into board meetings and said that I have to move a negotiation because it's going to be the first day of my period.
Yeah.
And it's the worst day for me to stay calm and stable.
Wow.
Which is a massive shift.
So
right?
big. Yeah.
And those are the conversations I want to bring about. And I will say I've worked with some really, really great men who have been open to these conversations and making changes in the workplace to kind of help women excel and exceed and not tap out of corporate America.
Right.
But I think when men don't understand this, there's just so many more arguments, especially when it comes to relationships. Yeah. Instead of if they understood, okay, this is the 3-4 days before the period, she's highly emotional, let me not irk her, irritate her, she might blow up on me, crash out. Like it's not personal.
Right.
Right? Because it's harder when you have a crash out.
Yeah.
And you are someone who's stable and, tries to communicate in a kind way, which I try to.
Yeah.
And then the other person's calling you crazy.
Right.
And I'm like,
yeah.
Do you understand what's happening inside my body right now? No, you don't.
Right.
You have a 24-hour cycle. So when you crash out, there's a problem with you.
Yeah, exactly.
I actually have a reason.
Yes, please, let's look at the entire 4 weeks. 3 weeks have been perfect and flawless. So this week, you gotta let me do my thing. Yeah, totally.
Yeah, no, so I hope men listen to this episode so they can understand how to be more supportive.
Yeah. I mean, and it's definitely not to excuse, crazy behavior, but I think there is this understanding that has to happen. When we accept this is biologically what is happening in our bodies, there's very little control over it. And we do our best with all of our coping skills and, all of the things that we're learning in therapy to make it, manageable. But sometimes your hormones really do take over. And I think when everyone can just talk about it more freely and not make it such a taboo conversation or a weird, uncomfortable conversation, then we're just on the same page.
I want to be careful how I say this because I know everyone's body is so different and, we're not a monolith. And sometimes I feel like I will push myself a little bit more, even though my body's telling me to take a break. But the one thing that I see on social media is this whole, I'm in my luteal phase, don't talk to me or don't bother me. Or now I'm ovulating, now I'm doing this. And it's great to be conscious of it, but I also want to move away from using it as a crutch to prevent you from doing anything or from acting stable and sane. So I'm curious if it, just from your personal opinion and not necessarily as a medical professional, how much of your mindset and your psychology do you think can impact how your body reacts?
Yeah, I mean, that's a great question. I think, at least for me, it's almost like when I know that I'm approaching my luteal phase, for example, and when I know I'm getting into that phase that I'm going to be a little bit more sensitive, a little bit more emotional and reactive, it almost helps diffuse it for me in a sense. It's almost okay, I know that's happening. So I know I am not crazy and insane and irrational and whatever. I know that this is just a shift that is happening temporarily. So it almost helps me handle myself with care. And it helps me meet myself where I am and then kind of restructure my life a little bit, kind of like you were saying, rescheduling some meetings. I'll probably be a little bit more mindful of who I'm interacting with, how many social engagements I'm a part of, things of that nature, because I know maybe where I will not have energy to do that.
Yeah.
So if anything, I think of it more as an empowering thing. Like, again, not to excuse bad behavior, not to excuse, being rude and nasty to people or to ourselves, but it's just a way for me to know that like I can give myself a little bit more grace during this time.
And also you can take accountability in a way, and that's how I look at it. And I think it's important to see it from a mature perspective of not making it everybody else's problem.
Right.
But because I know I'm going to be a little low energy, maybe don't have a high tolerance for bullshit. I usually don't, but in that time I definitely don't have a high tolerance for bullshit.
Yeah.
So I want to take accountability of where I'm at and not expect everybody else to know. Yeah. So I will plan my life around it. Yeah. I'm not going to have like a big conversation or a big meeting and then be offended that I was coming off as rude. Right.
Definitely.
So I think that's an important piece to address. Okay. I want to touch back on this whole study about men's sperm, women's eggs. It is a small sample size. It is specific to the mitochondrial DNA, which I don't know what that means.
That's
All
perfect.
I know is that it's testing a specific thing.
Yeah.
What do you think this really means? Like, what message do you want to give out? Because I want people to have, some type of level set expectation.
Definitely. Yeah. I think it is really important to remember that it is looking at 22 women from the ages of 20 to 42. So a lot of fertility conversations happen outside of that as well. And it is a smaller sample size. So we can't extrapolate a ton of data and make it really generalized. But if anything, I think the study just starts to hopefully open up more avenues for more research in terms of fertility and eggs and egg quality. I think the other important thing to note is that it was only looking at the mitochondrial DNA. So that
I have no idea what it is.
Which you said it perfectly, and I'm very impressed. The scrubs are really working for sure. But it's, one part of the cellular structure, but a lot of abnormalities happen in the nuclear DNA. That's where a lot of the chromosomal abnormalities happen, and the study wasn't looking at that. So even though the study was able to conclude that in this sample size, compared to blood and salivary cells that showed many more mutations as a woman was aging, the egg mitochondrial DNA did not show a statistically significant level of abnormalities, but that doesn't really show what's happening, in other parts of the cell and everything like that. So I think I wouldn't necessarily now use the study and say, okay, great, we don't have to think about fertility until we're 45 or anything. I would still, really be mindful about your own timeline, but just knowing that maybe there is some, more area for research and exploration with this, and maybe the eggs are a lot more resilient than we thought they were, which can be a really helpful thing to live with and carry.
I love that it's out there and people are talking about it, and that it's prompting this conversation, because it's gonna just build more curiosity in men and women. Definitely. So that's the really exciting part for me. Yeah. Okay, I want to turn to your personal life.
Okay. Need some water for this one, probably.
You are a very accomplished woman. You're obviously very beautiful.
Oh, thank you.
You have a great personality. You're in your 30s now. Yeah. Are you dating? Are you single? Talk to me about that.
Oh my gosh, yes. So yes, I guess single is my status, but dating, exploring, kind of, coming back to that whole scene. I was in a long-term relationship in my 20s. And that ended almost a couple years ago, about a year and a half. And I think that, I think obviously, yes, people see me as a doctor and, I'm accomplished and have all of these things. But at the end of the day, I'm also a person. I'm also just a woman in my 30s. And I think, we high accomplished, successful women deal with the dating world the same way. But I think the last year and a half have been really interesting because it was a lot of relearning who I am and relearning what's important to me, what I'm looking for in a partnership or a romantic relationship. And I think there's just been a lot of healing work that has been really grounding for me. And it is, in my last relationship, there was a lot of how can I make two pieces fit that just were not supposed to fit. And I think as women, we accommodate quite a bit, especially as women in these fields. We maybe have to be a little bit more sensitive or are trained to be more sensitive to the male ego, and maybe set aside a lot of expectations or set aside a lot of what we expect in a partner to just like kind of find harmony. And then through that, I just realized like the things that I was hoping for and want are actually very reasonable things that that I just did not feel confident enough to voice and to manifest. So
I want to know what are some of those things, because I feel like we will align on them.
Yeah.
And I hear this all the time where it's like, you're a lawyer, you're accomplished, you're kind, you look a certain way, and why haven't you found someone?
Yeah.
And I'm like, there isn't men lining up. I mean, there's men lining up, but not the ones that I want, right? And then it's like, your standards are too low, you're expecting too much. And I'm like, how is it expecting too much if I want someone to match my energy?
Right.
You know?
Yeah, definitely.
And the bar tends to be so low. So I'm curious, what are some of these reasonable expectations?
Yeah. I mean, honestly, I think it, like right off the bat, it's important for me that someone is established in their life and is able to survive without me in the picture. Yeah. I spent a lot of time in a relationship where I was supporting my partner, and it just felt like this, it just was not balanced. And I think that wore on both of us in different ways. And so at a very basic...
And when you say stability, is it just more, is it mental, financial, or both?
Both. Yeah, both. Yeah. Like, I think it's important to me, like community and a social structure is really important to me. So I need to know that someone has their friends, has their community, and whatever that looks like, has their hobbies, interests, and is able to just find fulfillment in their own life with the people around them, with the work they're doing, and just be really solid. Because that's how I feel. Like, I feel really good about where I am in life right now. And I just want someone to be additive to that and like bring a level of peace to that.
Right. So you're not their entire happiness.
Exactly.
Like, it's not like if you're in a fight, their whole life doesn't fall apart.
Right.
Because that's so much pressure.
Yes.
And I know there's part of it which is like really Bollywood. I mean, I grew up with Bollywood, so it's very like live and die together, ride or die, like drama. You know, all of that, which from time to time is a little, you know, attractive to me, and I'm like, oh, that's cute, but but it's such a burden, and especially if you're like an independent working woman, it's like we're kind of on the same level as far as life, and for me to now lend all of my emotional support to you as well, it's a lot.
Yeah, and we're working in fields in which we are on, and that's what I say. It's like, yes, I like work 9 to 5, but it's not 9 to 5. Like, I am seeing, you know, 16 patients a day, like emotionally charged appointments sometimes, and it's a lot to be performative and to be on all day. And so sometimes, like, I know I need a certain type of decompression and space, and I'm able to lean on my friends a lot, or like lean inwards into myself to find some peace and stability. And I think it's important that like people that come together are able to kind of do that independently, and then when it feels appropriate to kind of share that space as well. But that independence has to be there for me.
This is a personal question, but do you want to have kids?
Yeah.
I am curious because for me, the financial stability portion wasn't as big of a deal in my 20s as it is now.
Yeah.
And to be clear, I mean, I always dated somebody who had a career and had a job and was pursuing something in life. But, you know, thinking about money and bills and all of that wasn't really top of mind because I was taking care of myself.
Yeah.
But I do think about that now, the financial security. And I think people will immediately be like, oh, women just go after money, which also men go after looks all the time. So it's like that's just been the standard. And I think there is some science to that in some ways, which I won't dig into. But I think the financial stability has become so much more important to me from a place of motherhood and seeing like cousins or friends have difficult pregnancies and have to take a step back in their career.
Totally.
So I have the viewpoint where I don't know if I want to be 50-50 financially with my partner because I don't want to be in a situation where if I have to take a step back, we can't pay the mortgage.
Oh my gosh. My perspective on this has changed quite a bit. When I was, you know, in my 20s, it was very much like, I'm an independent working woman. Like, I can take care of myself. I can take care of my partner. Like, you know, I don't need to subscribe to these societal norms, whatever. And then I remember my parents, shout out to my parents, you know, that they were like, yes, like all of that is good. All of that is great. We are happy that you're an empowered female, but that does exist as well, in which like things happen and like you want to be able to lean on your partner. And I think especially we live in LA, it's an expensive city. I hear from friends that, I mean, child care is astronomically expensive, and just raising a child is a really, you know, big financial component. And I think now I think of it less as me not being empowered, but me just wanting to, again, have that additive component with my partner, that if I do need to take a step back or I do need to pivot in a certain way because of whatever's happening to my body or our personal life, then I need to know that I can depend on someone. And emotionally is 100%, that matters absolutely. But I'm realizing the financial dependability does matter more than I wanted to believe.
Yeah. It's just the reality.
Yeah.
That's just how it works. Tell me, what are some of the other things that you're looking for?
Oh my gosh.
I'm becoming like the South Asian matchmaker now.
No, I love it. Are we going to manifest together? Let's manifest. Yeah. So like all of those, you know, Maslow's hierarchy stuff. Yeah. Like job, career, ambition, all of that for sure. I think communication's really important to me.
Oh my gosh, yes.
I'm obviously a talker. I cannot keep anything concise. And it's really important to me to feel heard and to just know that the things that I'm saying are landing in a safe space. Because I've been in experiences and relationships and situations where I just felt like, and I think I'm a pretty good communicator. And so I felt like the things that I was saying are just not being absorbed. And that type of like mental energy that creates, where I'm like, I don't know in any other way that I can say this to get my point across. And it just, two people have to be on the same page with communication, because I can say it in a million different ways, but if it's not going to be received, then that's where the conversation ends. And so I think that active listening component and that communication, high EQ, all of that is so important.
I know some people listening will be like, that's such a high expectation. I'm like, but that, to me, that's literally the bare minimum.
To communicate.
Yes. Yeah, it really is. I think men do struggle a lot of times to communicate what they're feeling. Yeah. Right? Because they've been like taught to not have feelings, not get emotional, and all of those things as well. So, but the burden isn't on the woman to fix that. Yeah. It's on them to understand themselves. Like, you have therapy now. And I always say, even if you don't have access, like you don't have the finances, or you don't have an insurance that, you know, lets you get all those things, because our system is not that great.
Totally.
But in this day and age, you have podcasts, you have books, like go get 8 Rules of Love by Jay Shetty. I love it. I'm such a huge fan of his. Like, it has such practical advice and communication tips, and especially for men, because sometimes I know they do struggle to respond or hold space for our emotions.
I think that's such a good point, where it's, yes, absolutely, we can honor and acknowledge that might be a difficulty, but we are very well resourced, like a book, a podcast, all of this. Like we have done so much work on ourselves, you know, all throughout life. Like women, I feel like we're doing such a great job. And I do think it's reasonable to ask men to work on these things too. And I think that's just where I've learned to be a lot more discerning. I think when I was younger, I would probably give a lot of things time and not trust my gut. I think that was a big one, just to think, oh, well, things will fall into place. Like, they'll get better. Like, I'll shift around my criteria, hopes, and expectations. But now I'm just a little bit, I definitely don't consider myself rigid or having high expectations, but I think I'm really discerning. Like, I know what I need more than I ever have before. And I just have to trust that. I just have to trust my gut.
For sure. And I think there was also this whole rhetoric, at least for me growing up, well, that's just how men are. Yes. That's just how men are. And I'm like, no, but no, that's not true. Because now, and that's what I think is so great about women's health, because you can say the same thing, right? You can just say, that's how women are. Right. That I'm on this phase and that's what that is. And that's why I brought it up earlier, that I think awareness is so important, but then taking accountability, men or women, with what's going on with you is your problem. So that you can, you know, you have to be able to come together and make each other's lives better. Yes. And yes, you should be able to lean on your partner. And
Yeah.
I think you can work through these things together.
Absolutely.
It's very confusing because we're kind of the first generation who's digging so deep into mental health and wellness and trauma and
dating culture.
It's all so new and it's coming at you so fast. And our parents didn't have to deal with a lot of this.
Right.
So we're reparenting ourselves. Yes. And then to have to reparent another person while you're doing that is way too difficult.
Definitely.
While you're also having a career, being ambitious, being independent. And maybe that's why there's this push for the trad wife culture, right? Because they're like, this is too much. Like the whole hustle culture, women can do it all.
Yeah.
It's too much because a lot of men have not stepped up to the plate.
Sure.
You know, but I do believe that they can.
Yeah.
Like, I'm not this like man hater.
No.
I think the more women stay firm in their expectations, especially women like yourself, right? There are men that will meet you there.
Absolutely.
And I've met a lot of great men. Yeah. So, and I think that's why I just have such a positive opinion of it. Yeah. I just wish there were more like men's groups and men's circle. Yeah. So they could like have a brotherhood.
Definitely.
But I love that. I think I love that you spoke about this so confidently. Mm-hmm. And I also, it's very calm. Yeah, you know, it's coming from a very calm place, and I really love that.
Yeah, thank you. I mean, I love thinking about my brain and thinking about where it's come from, where it's going. Like, I will say I'm in a constant state of evolution. Like, I will never have everything figured out, but I just am always trying to learn as much about myself as I can, so then I can just more confidently express who that is and just be more confident in knowing what I want. And I think that is the most important thing, is like, if we don't know what we want, then we're going to be flailing out there, and all these little sperm are going to come up to us.
This is Sparta.
The sperms are coming, and it's like, well, do I choose that one or that one or that one? So it's like, I need to know what I need, so then I can decipher through the sperm a little bit better. Oh my gosh.
Okay. Last week I was a judge on a tech week dating show.
Oh my gosh.
So hilarious. There were most of the people were comedians, and they called me on as a relationship expert, which I was like, I have a podcast called Platinum Pussy. I don't know if I'm a relationship expert, but I'll take it.
Yes.
It was hilarious. So people are going up for like 2 to 5 minute dates, like right in front of everybody live, and they're getting to know each other, and then you judge the date.
So people are watching this happen.
Yeah, there's people in the crowd watching, and people just volunteer from the crowd as well to go on a date. Yeah. And then there's a panel of judges sitting right behind them on stage watching it, and then you kind of comment. And I had the funniest outburst. But this guy, I mean, one of the first things he says is like, oh, I just don't want somebody who's a gold digger. And I was like, fair enough, I get that. And I think he's some tech successful person. But then his personality was just so nil. Like the whole conversation. I mean, the woman was so interesting and had so many layers. And it was almost like he decided that I have financial stability, so I don't need to try at all. And that made me think, I think for so long that was enough for a man, is just to have the money. Like, the women will look past the looks, right? The, personality, the kindness, and all of that, just for the financial stability. And it made me think from like an economist perspective, right? My economics brain was like popping off of what is happening to men in this day and age. Yeah. And I had a little outburst where I was like, listen, we live in a day and age that women can provide for themselves. Yeah. So we are looking at men from so many different markers, right? Like, unless, and this is no hate on the barista or the struggling, starving actress, but unless you're that person who's like, I just need financial security to like kick off my career, it's not gonna work. Like, you got to give me so much more than that. Exactly. And I think men are still stuck in that mindset that works.
Wow. I guess that's not shocking to me, but I guess it makes total sense, where if that is traditionally what you're bringing to the table, and that was what anyone evaluated you on and judged you on was your monetary success, then of course you can get away with anything else. But now, where yes, women are supporting themselves, are socially involved, have hobbies, travel on their own, like all of these things. Like we really don't, like, you know, a lot of women really don't need that. And
they want a partner.
Yes. Someone to have these experiences with, to have these conversations with, to just be a team and be a partnership. And yeah, of course, the money is important and all of that, but you have to have a personality.
Yeah.
Like you have to be able to hold a conversation. And
it's also so sad. I feel like it's sad for a man to think his only value is his money.
Yeah. Yeah.
Outside of just me being infuriated as a woman, where I'm like, you've got nothing else to offer. I'm also like, I feel bad for you that that's all you value yourself on. Because imagine the type of psychological stress that's there if like my stocks just dropped or you know she's gonna leave me and so just being like that wholesome person, because it's a partnership, and I always say you never know, you could marry somebody who's very financially stable and life happens.
Totally.
So it's teamwork, and I need to know you have grit, you have character, you have personality, like we can ride through the hard times together. So it was an interesting revelation though, where I was like, oh, a lot of men still think like that's
really interesting.
That's okay. And like for me, that's the bare minimum.
Right.
Yeah. Like you having a career is just like your contribution as a human in this world.
Right. Yeah, you would think. Well, what's interesting is I listened to you talked about Jay Shetty before. So I listened to Jay Shetty and Emma Watson's interview that happened recently. And there was, and I think Emma Watson is so eloquent and well-spoken, and I would love to be her friend. And I think she said something that was really powerful about dating and how dating is such a dance. And I thought that was really, it made a lot of sense, because it's, with a good dance, you have to have two strong partners that, you know the dance, know what it takes to make this happen. But there has to be a certain finesse, and everyone has to kind of be on the same page, feeling the tempo, feeling the rhythm, and it's not gonna hit. And I think especially in a day and age like this, where you have endless options, a million apps, like people to decipher through, like it just almost seems like a stroke of luck or the universe to bring the dance together. But I'm hopeful. One sperm.
One sperm. I want to ask you, because this is Platinum Pussy.
Yeah.
And a lot of my desire or ambition for doing this podcast was the stories we're told as younger girls about our bodies and our sexualities and how sex is more for the man and how to cater to the male ego. What were you taught about sex, or was it ever talked about growing up?
Oh my gosh. So as you alluded to, I'm South Asian, Indian, and first generation. So there was not a lot of conversation growing up in my household at all. I remember there was, I think in 5th grade, we started talking about puberty. And then it was somewhere in middle school, we had our sex ed, curriculum. And I think I shouldn't even know, I don't even know if I should admit this, but I forged the signature of my parents for the permission slip to do the, oh my God, I can't believe I'm saying this. Yeah. To watch the sex ed video or whatever.
Yeah.
Because somehow I learned from such a young age that these conversations were taboo and inappropriate. And so I didn't even want to have that conversation with my parents, that was something that I was going to be learning. So I committed a crime. I signed the form.
You'll be okay.
You're way
past the statute of limitations. You're fine.
Okay, thank you. So yeah, I mean, that just, I think, gives an example that I did not feel comfortable. And it was a very modest, or I think Indian culture, at least in my family, it was very traditional, very modest. And we didn't talk about bodies. We didn't talk about intimacy. The intimacy that I, watched around me was holding hands and maybe a kiss on the cheek. And so it was just a very different conversation. And I think that's kind of what really empowered me and made me excited to go into women's health and niche down into women's health, was because I never really grew up having these conversations, and especially with a healthcare provider or someone in a mentoring role like that. And I really just wanted to, be someone that, is a person of color and a child of immigrants, someone that was able to kind of just have these candid conversations. But it was not a topic that we discussed. What was it like for you?
It's pretty much the same. I feel like that's kind of the common rhetoric. I did have some information about it, and I think it's because my mom is a single parent.
Oh, okay.
And I have 2 older sisters.
Wow.
And so there was like a little bit about like, okay, what is sex and how to stay away from men.
Yeah.
But the gist of it was don't do it.
Yeah.
You know?
Exactly.
Which I think, and I always say, I think it's fine if you want to wait till marriage, but I still think you need to know about it and talk about it, because you're going to get married and just be in shock.
Yes.
And not understand what's happening.
So especially in like South Asian communities, I hear a lot about vaginismus, which is basically where the pelvic floor and the vaginal canal will just really tighten when anything enters it. So that could be a tampon, that could, of course, be any toys, penis, anything like that. And so what happens is a lot of women end up experiencing a lot of pain with penetration or penetrative sex, or even like digital penetration of any type.
Yeah.
And so it is, and then it's almost like conditioned to believe that like, okay, sex is just like painful and it kind of sucks and we'll just like bear through it. And in my opinion, and I think yours as well, like sex should be very pleasurable.
For sure.
And an enjoyable experience and something that is really empowering. But, these things aren't talked about because we just haven't really created this space to be able to feel comfortable having conversations, not only about sex, but our own bodies. So then when something like that happens, it's, who do you go to? Who do you tell?
I think it just is so harmful in so many ways to not know what your body is supposed to experience or feel. Because then, like you said, you do just think, okay, well, this is just something that's for the man.
Yeah.
And it's not just particular to our culture.
Yeah.
It's been ever since I started doing like Platinum Pussy, because I did a play with the same name last year. And in speaking to so many women about these type of things openly, and like, how did you learn about sex? What was your first experience? They're like women from all races, all religions, backgrounds. There's such a shared experience around that. So I love that we're touching on this, because my whole purpose is for younger girls to be empowered, and whatever choice they make, whether they want to be sexually active, not be sexually active, just know about their health, know about their sexuality, and not feel shame around it, so they're not taken advantage of.
Exactly.
Like that's the most important part to me.
And when we say knowledge is power, I mean, it starts here too. It's knowing what is happening in your body, and then just feeling confident about expressing concerns or areas of discomfort or areas of a gap in knowledge to really be able to find that confidence again.
I feel like I could keep talking to you for so long, and I know this episode's already been very long. So I want to ask you one last question, and it can be as short or long as you want it to be, but what advice would you give somebody, a woman who's in their 30s, looking for partnership, is kind of concerned about their health? Like what should they focus on in their day-to-day?
Oh my gosh, that's such a good question. I think what I would say right off the bat is taking a deep breath and knowing that time is not running out. We are just trying to navigate this crazy world the best we can, and we are all coming from our own unique experiences with our own trials and tribulations. And I never really thought that I would be in my 30s, single, living in LA, navigating all of this. Like when I was younger, I was like, oh, I'll definitely have a kid by 30, maybe a second one by 35. And so when the timeline just changes kind of unexpectedly or even expectedly, if that was in the cards, it can just feel really disheartening, and it can bring about a lot of anxiety of, well, this is not what I had planned, especially for someone who's pretty type A and organized like me. But I think there is such a power in resilience and knowing that, like, regardless of what has happened, like, there's always a next step. There's always something to look forward to. And knowing that all we can really do is focus on the present and what we're able to control now, I think is the most important thing that's brought me more peace in the last couple of years. And so for me, I am focusing on continuing to get really confident in who I am and the things that I bring to the table, what, I'm looking for in terms of my, friendships, career, hobbies, extracurriculars, partnerships, whatever it is, because then I'll just attract more alignment in whatever that looks like. And I think alignment is a really big thing for me right now. Just getting rid of what's not fitting and then opening up space for what can. So in a health perspective, I think it's really like focusing on my lifestyle, my sleep, what's that quality like, my diet, my fitness, and then my mental health piece. Like, how am I navigating these really tricky and complicated thoughts and bringing self-compassion to myself? Because if I'm not nice to myself, like, I can't expect anyone else to be either. So yeah, I think just reminding everyone that it's a process and our journeys are so dynamic and diverse, and we're just doing the best we can every step of the way.
That's such a beautiful answer. It just puts me at ease, and you speak so eloquently.
Thank you.
You really do. I feel just a lot more confident just having this conversation with you, and I hope people listening feel the same way. I hope it activates people to focus on their health, their mental health, their well-being, and just being educated about themselves, and also for men to really step up and get to know themselves as well and become equal partners. So thank you for being so open and vulnerable and helping people out with your medical expertise, but also just who you are as a person and being vulnerable. This has been so lovely. Thanks again for being at Platinum Pussy, and to everyone listening, I will see you again next week.